Good morning, everyone. Are you able to hear me clearly?
Yes.
All the way at the back? Okay, good. First and foremost, thank you so much for the introduction, Professor Lee. And I would like to thank the organizing team for giving me this opportunity to share our experience from Sabah. And it's actually quite nostalgic to be back here in this part of KL or PJ because I did my A-level studies in Sunway College way back in 1994 to 1995. So that was 30 years ago, so you can probably guess my age as well. Okay, so today's presentation is more like a sharing session on our experience from Sabah in regards to enhancing skills-based training in screening, diagnosis, and treatment. So this is the overview of my presentation. I'll start with just a bit of introduction and I'll go into the gist of today's session, which is the decentralization of cancer care project that we have in Sabah, and finally take home message. Okay, so I think in any organization, skills-based training is very important. It is an essential part of capability building, focusing on enhancing the knowledge and skills of the team members, the various team members, and more so for healthcare professionals like all of us here, who are involved in cancer care, especially with the rapidly evolving management in cancer care, and also the rising disease burden as mentioned by Prof. Khatijah just now. So for today's sharing session, I am going to concentrate on treatment actually. I mean, we have heard from Prof. Khatijah about skills in communication, breaking bad news, so all that is very important, I think, the whole process from screening to diagnosis and eventually treatment. So I'm going to talk about specifically the project that we have in Sabah, which is the decentralization of cancer care that we have embarked on in the last few years. So I would like to share on how we actually got started. How this project was initiated. So I work in the public sector from Hospital Wanita dan Kanak-Kanak Sabah, or also known as Likas Hospital. So that is the main cancer center in Sabah, but we also cover wilayah Persekutuan, Labuan, and sometimes certain parts of Sarawak that is nearer to us, and also occasionally Brunei patients, Malaysian patients who are residing in Brunei. Okay, so in the public sector, we are faced with so many challenges, right? From limited resources to limited patient access to cancer care. Have you been to Sabah? Yes? Who has been to Sabah? Okay, quite many of you. So as you know, Sabah is very huge, right? Sabah is very huge. It has a vast geographical area, and with a population of 3.6 million. So the distance and the travel burden is really a major issue for us. for patients from all around the state to come to the only cancer center in Kota Kinabalu to receive treatment. And many a times, patients and us, as the healthcare professionals, we have to, or we are forced to make very difficult decisions related to patients' treatment. And this situation was actually much worse during the COVID-19 pandemic, with the MCO. So patients had difficulty to come from around Sabah to Kota Kinabalu to receive their treatment. So that is when the idea of this project came about. So this is a map of Sabah. Many of you have been to this part of Malaysia. As you can see on the map here, there is a great distance between all the district hospitals and Kota Kinabalu. This is where our cancer center is located. So the furthest, I think, is Tawau Hospital, in the east coast of Sabah. And I have included Labuan here as well, even though it is a federal territory, but I have included it here because the oncology service in Labuan Hospital is covered by our oncology department in Likas Hospital. So there are 7 of us, clinical oncologists, covering the whole state. I also have my colleague here, Dr. Asnan, one of the 7 clinical oncologists in Sabah, covering the whole state. And we have 5 visiting clinics to Tawau, Sandakan, Lahad Datu, Keningau, as well as Labuan. These are all hospitals with specialists outside Kota Kinabalu. So we travel to all these visiting clinics on a monthly or 2-monthly basis. And out of these 5 hospitals, only Keningau has not got chemotherapy services at the moment. So this is an article published in 2019 by Nur Azrul Yahya, showing that East Malaysian patients, they need to travel a much longer distance and a much longer time taken for them to reach the nearest radiotherapy facility. And this is also the same distance and the same time taken for them to come to the nearest main cancer center, providing chemotherapy as well as other systemic treatment, as compared to their counterparts in Peninsular Malaysia. So you can see, the much longer time taken here. Unfortunately, is also contributed by the not so very nice, road condition, infrastructure. Okay, I got this from the Sabah Cancer Registry report. So you can see that there are 8,818 cancer cases reported between 2012 to 2016, with the 3 most common cancers being breast, colorectal, and lung cancers. This is actually similar to the national report, within the same period of time. I think there is some underreporting. I think the actual number could be higher than what is reported here. And our main cancer center in Kota Kinabalu has become more and more congested over the years. So that is when we talk about decentralization of cancer care, away from the main cancer center, tertiary center, for us in Kota Kinabalu. So I think decentralization of cancer care is not really something new in the public sector, but we feel that there is a need to further strengthen this, yeah, so that more cancer patients can receive, they have the opportunity to receive treatment closer to where they are staying. So how do we enable decentralization of cancer care to occur? Yeah, so here are some of the key elements or key components. Of course, we need human resource and capability building, including skills-based training. We need development of facilities and infrastructure. We need accessibility to drugs, yeah, especially the new medications, novel therapies. We also need good data system, good data collection system. Even though all these are important, but today I am going to narrow it down to capability building, skills-based training for our nurses actually. So this project is undertaken through a collaboration or partnership, yeah, with Roche, but it's actually involving a number of stakeholders, as you can see here. So this project is mainly to train the healthcare personnel, mainly our nurses, yeah, nurses who are involved in delivering chemotherapy and other systemic treatment, especially outside Kota Kinabalu, yeah, in the various district hospitals that I have shown you on the map just now. So this project, this public-private partnership, yeah, is undertaken with the collaboration of all the stakeholders here, including the Sabah State Health Department, our radiotherapy and oncology department in Likas Hospital, Roche, as well as the various hospitals with specialists in Sabah. So how Roche supported us, among others, include the provision of venue for the training and also the engagement of retired post-basic oncology nurse trainer to conduct the training workshops. So what I find in regards to the key benefits of having this public-private partnership from this particular project, I think the main thing is the pooling of resources between the public and the private sectors together, which actually help to lessen our financial and budget constraint. Also, the project was able to kick off rather quickly. It was commenced in quite a short period of time from the initial idea. And of course, with the partnership, we were also able to promote innovation, creativity among all the stakeholders, and also the use of technological cooperation between all the partners involved in this project. So it first kicked off at the end of 2021. We had the basic of cancer care workshop, or we call it BOCC for short. This was held in Sandakan. So it's a face-to-face training. We divided into part 1 and 2 actually at that time. So it involves hands-on lectures, and then there's hands-on experience. There is also OSCE over a period of 3 to 4 days. Yeah. And this is actually like a much faster way to train and upskill our nurses as compared to the formal training, the post-basic nursing, oncology training, which takes up to 1 year, and it requires our nurses to be away yeah, from the workplace, from their home, for much longer period of time, yeah. So after we kick off in Sandakan, we also had another BOCC workshop in Tawau in 2022, followed by a state level decentralization of cancer care workshop in May 2023. So all the nurses who attended the BOCC workshops, they were subsequently given credentialing and privileging, or CNP certification, after they have done attachment at a chemotherapy unit, and also filling up a logbook and submitting the logbook. So this certification is not only at the hospital level, but also certified by our state health department. So moving on, in December 2023, we had this standardization of BOCC and CNP syllabus agreement during the workshop, whereby this syllabus is going to be used for all subsequent BOCC workshops and also CNP certification within the state of Sabah. So this syllabus is actually adapted from the national syllabus. Yeah, but we tailor it according to our local needs and setting. And before that, our nurses actually had the opportunity to meet virtually and had sharing of experience with the head of nursing from Damai's National Cancer Center in Jakarta. Yeah, so they also have this basic oncology nursing training program where they use a lot of tele-mentoring, yeah, because of distance to other district hospitals. So they use a lot of tele-mentoring as part of their learning process, real-world learning process. So our local training program is also adopting this tele-mentoring. Yeah. Okay, and then in March this year, we had the first training the trainer workshop. So we actually had about 11 oncology trained nurses from all around Sabah to be trained as trainers. Yeah, so that they can subsequently conduct the local BOCC workshop and not just rely on the one person who had done all the training before this. Okay, so since then we have done another 2 BOCC workshops this year, just recently, in Keningau Hospital last month, and also in Likas Hospital itself earlier of this month. So for Keningau, as I mentioned earlier, we have not started the chemotherapy services here. So this BOCC workshop is to help facilitate and support the commencement of chemotherapy services in Keningau Hospital in the very near future. And further to this, we hope to move even further, forward with more training of healthcare personnel and continuous eco-training, tele-mentoring, just to ensure there is a continuity in the learning process, team-based learning approach, and also tele-mentoring, just to maintain and to ensure there is a sustainability in our project. I am delighted to share that since this collaboration or partnership project started, we have given, trained and given certification, CNP certification to 45 nurses from all around Sabah. And in addition to that, with our 2 recent BOCC workshops that we conducted this year, we have trained another 53 nurses, but the CNP is still underway, yeah, because they have just been trained and they need to be attached to a chemotherapy unit, and they need to fill up their logbooks, yeah, before they get the certification. And this number, 45 plus 53, will definitely complement our existing, now we have about 47 oncology trained nurses, formerly trained nurses throughout Sabah, yeah, 47, but in various disciplines, not just in adult oncology, but also including other oncology disciplines as well, like gynae oncology and pediatric oncology as well. So with the increased numbers of nurses having CNP certification in chemotherapy procedures, our aim is to improve the patient access to cancer care, particularly in chemotherapy and also other systemic treatment, and also to close some of the care gaps within Sabah. And as I mentioned earlier, this is also to facilitate and support our future plan, yeah, for expansion of service within the state. So with the acquired knowledge and skill, our nurses definitely feel more confident. Yeah, they are more comfortable. They are more confident to help us manage oncology patients in the various hospitals around Sabah, outside the main cancer center in Kota Kinabalu. But more importantly is also the safe handling and delivery of cancer drugs, yeah, with reduced risk of errors, yeah. Hopefully, I don't have the data yet, but hopefully in the near future we are going to also look at how we have evolved and achieved success by looking at, for example, the rate of extravasation, for example, in hospitals that are not in the tertiary center. And of course, ultimately, what we would like to see is the improved patient care and outcome. Okay, I'm actually coming to the end already. Take-home messages. So if we have identified any challenges or gaps, unmet needs in our healthcare system, it is possible to design and deliver a solution through a public-private partnership with the pooling of resources. Of course, we need support from various stakeholders. Everyone must be in it together. Everyone must be committed in their roles and responsibilities to ensure a successful partnership. Of course, every step matters, no matter how small it is, but every step matters in the process of improving healthcare system. Ultimately, we want better patient care and treatment outcome. And I would also like to say the training of healthcare personnel, particularly in my talk is about nurses. But why do we need to train them? Because they are the asset, right? The medical officers, the nurses, our radiation therapists, and so on, they are all our asset, our backbone that work together with us, the clinicians, to ensure patients are taken care well with better patient outcome. That is our main goal. So I particularly like this quote by Theodore Roosevelt: "Do what you can with what you have, where you are." And apart from Mount Kinabalu, anyone has gone up to Mount Kinabalu? Yes? Wow. We also have many other interesting attractions, must-visit places in Sabah. So please do come and visit. And before I end, I would just like to share a photo of my colleagues and I at the summit of Mount Kinabalu just recently on the 3rd of June. With that, thank you so much.